Welcome back to the Dr. Jeffrey Tauth Heart Talk Show. I'm your host, Dr. Jeffrey Tauth, and today's show is called Dr. Jeffrey Tauth, Intermittent Fasting's Hidden Heart Impact. And trust me, it's juicier than your cousin's peach cobbler. So here's a wild question for you, Ashtiyi. What if I told you that skipping meals could actually save your heart? I know, your grandmother is rolling over in her grave right now, but stay with me here. We're diving deep into how intermittent fasting might be your cardiovascular system's secret weapon, or its worst nightmare. The plot thickens, folks. Now let me blow your mind with something most people don't know. When you fast, your heart muscle goes into what we call autophagy. And before you ask, no, that's not when your car drives itself to McDonald's. Autophagy is basically your heart's housekeeping service. It's like having a microscopic Marie Kondo in your cardiac cells, throwing out the junk and keeping only what sparks joy, which in this case is healthy, functioning heart tissue. But wait, there's more. Intermittent fasting can reduce inflammation markers linked to heart disease by up to 40%. Yep, entirely true. I can't make this stuff up. It's like turning down the fire alarm that's been blaring in your arteries for years. Your blood pressure drops, your insulin sensitivity improves, and suddenly your heart is getting the vacation it desperately needed. Here's how I explain it to my patients. Imagine your cardiovascular system is like a highway during rush hour. Everyone's honking, nobody's moving, and the whole system is stressed out. Intermittent fasting is like implementing those carpool lanes and traffic lights that actually work. Suddenly, traffic flows better, everyone's less road ragey, and the whole system runs smoother. The science here is absolutely fascinating. During fasting periods, your blood vessels get to kick back and repair themselves. Think of it like finally getting to fix those potholes on the highway instead of just driving around them forever. The oxidative stress that's been sandblasting your arterial walls, it takes a coffee break. Your cholesterol ratios start behaving like well-trained pets. The good HDL goes up, the bad LDL goes down. Studies show that a simple 16-8 fasting schedule can reduce heart disease risk by 25%. If that were a pill, we'd be charging a fortune for it. Now, before you go full caveman and stop eating for 3 days straight, pump the brakes there, Tiger. If you're thinking about trying this and you've got existing heart conditions, maybe I should see you in the clinic. We need to talk. Safety first, people. Start with a 12-hour overnight fast before you graduate to the 16-8 method. Stay hydrated like you're crossing the Sahara, keep those electrolytes balanced, and monitor your energy levels like you're tracking your fantasy football scores. Let me tell you about Sarah. She's a 52-year-old teacher who came to see me with blood pressure that was higher than gas prices last summer. After getting medical clearance, she started a 14-10 intermittent fasting routine. Within 3 months, her blood pressure dropped from 140 over 90 to 125 over 80. She lost 15 pounds, and get this, we cut her blood pressure medication in half. Sarah went from feeling like a ticking time bomb to feeling like she could teach kindergarten and still have energy left over. That's the power of giving your heart the reset it's been begging for. But here's the thing about intermittent fasting. It's not magic, it's science. Your heart doesn't care about the latest Instagram trend or what celebrities are doing. It cares about consistent, sustainable changes that actually make biological sense. When you fast intermittently, you're literally giving your cardiovascular system permission to repair, rebuild, and refresh itself. Now, I don't want you leaving here thinking you need to become a monk to see results. Here's your homework for this week. Try a simple 12-hour overnight fast. Stop eating at 8 p.m., don't eat until 8 a.m. the next day. That's it. Track how your energy and sleep improve. I bet you'll be surprised at how good you feel when you stop forcing your heart to work overtime processing late-night snacks. Remember, folks, your heart is the hardest working muscle in your body, beating over 100,000 times a day. Maybe it's time we gave it the break it deserves. This has been the Dr. Jeffrey Tauth Heart Talk Show. Until next time, stay healthy, and remember, if you're looking for answers, check out drjeffreytauth.us.com. Later, y'all.